Try this top tip to get rid of your tennis elbow. Tennis elbow can be severely debilitating on the outside of the elbow here, stopping you playing sports such as tennis, squash, badminton, enjoying your life to the fullest, interrupting your activity and your ability to be healthy long term. I'm Dr. Jeremy Andrews. I'm a doctor of chiropractic here at West Chiropractic, and today I'm going to be talking to you about exactly what tennis elbow is, how it's caused, how you can diagnose it yourself at home right away after this video, and then how you can start taking some steps to fixing your tennis elbow long term. Tennis elbow. It is a common misconception that it has to be caused if you are a tennis pro or someone who plays tennis from time to time. It's just not the case. It is characterized as a repetitive strain injury on the outside of the elbow. Golfer's elbow, on the other hand, is something on the inside of the elbow through here. So outside of the elbow tennis, inside is golfer's. And again, you don't have to be a golf player to get golfer's elbow. Out of the two, which is more common? Tennis elbow is more common. Now, it can be caused by playing tennis, obviously, also with other racket sports such as squash, badminton, or table tennis. But you don't have to be a sporty player to have tennis elbow. Other ways it can be caused is with repetitive injuries like this. So turning around like that means the tendons that come off the outside of the elbow here will get very tight, they get overused. So often if you're on one of those big DIY weekends or even months where you're doing a lot of painting, screwdrivering, that can cause a lot of tennis elbow on the outside. It can sometimes be caused with people that work at a keyboard. It's less common. More so the RSI, repetitive strain injury we get from a keyboard, is usually around the wrist, usually on the outside of the wrist from the typing, extending those tendons. So you can hopefully see when I move my arm like that, and I move the fingers, you can see those tendons here. Those are the ones that are affected in a tennis elbow. On this side, you can't see them as well. Can't see them as well on the inside of the elbow here. Those are the ones causing problems on a golfer's elbow. So that's what we need to look for on a tennis elbow here. How do you know if you have tennis elbow? Well, it is characterized as pain around the outside of the elbow here. So you can run your hand down here and you feel that knobbly bit around the outside, okay? This is the what we call the lateral epicondyle. So it's often referred to as lateral epicondylitis. So any sort of itis means there's inflammation there. So tennis elbow is just inflammation around the tendon sheath. So essentially what happens is a tendon is something that joins a bone to a ligament or a set of ligaments. So the lateral epicondyle is a knobbly bit you feel here on the outside of the humerus and the radius, okay? The radius is the one that turns over like this. That's that thin shaped bone here. The ulna is the other bone that goes into the back of the arm here. Okay, you don't need to worry too much about those. So just think when you're rotating your arm like this, if you're doing any tennis, screwdrivering, that can often put a lot of pressure around these areas here. So inflammation at this area here from the tendon that's going into these four muscles here called the extensor carpi radialis, all big words. Don't worry about those, they're just extensor muscles. So I extend my wrist, that's what they do. They extend the wrist, extend the fingers, so bring them back. If they flex, that's that way. Okay, flexing is that way like this, extending, coming back like this. So anything extension, rotating, using those muscles is going to put an overload of pressure onto this area here. It starts to get very tight. You can get hot and get inflamed. It starts to cause pain. So it's an itis, an inflammation. So what do we got to do? We've got to try and bring that inflammation down, taking pressure off those areas. That's what we're going to talk about next. We've got to think about what are the things that are causing that. So we touched on them. Playing tennis, racket sports where you're holding it like this. Darts to a certain extent, computer work, riding a motorbike. We get loads of motorcyclists coming in here with tennis elbow issues and putting pressure on those areas. So we need to make sure we're taking the pressure off this, getting the elbow in the best position, having a look at the neck as well, see if there's any referral coming down from the neck, and bring that shoulder blade back as well. So very often that shoulder blade can put a lot of pressure through the arm, causes the elbow to take up more stress. So what does tennis elbow feel like and how can you diagnose it yourself? It is a sharp pain right on the outside of the elbow through here. It can often radiate down through the arm, causing a lot of heat, burning, achy sensation. If you lift something up or if you grip something tight, it can often cause a lot of pain around this area here, and it often causes a lot of weakness as well. So when you're trying to open a jar or open the fridge, driving as well, or opening the car door, if you're finding that that's causing pain, it may well be that you have tennis elbow. How do you test if you've got tennis elbow then? So the most common one, I have to be careful with this because I have to use my middle finger, so I'm going to try and do this as gently as possible. So if you look here, guys, I won't do it that way. I'll do it like this, okay? So if you push down on the middle finger here, okay, and you try and resist, I've got my left hand here, try and push down like this. Now, if I'm getting pain up here when I'm pushing down on that middle finger, it's very likely that can be causing a tennis elbow, okay? I'll just do it with these 2 fingers here. So again, I'm trying to push this way towards the camera here. And if I'm finding I'm getting pressure down here, going through the elbow on this outside area here, it's very likely I can have some sort of tennis elbow. That's a really quick and easy way to self-diagnose it yourself. And then you can start doing some of the treatments we're going to go through in the next section of this video. The gold standard is going to be an ultrasound. Now, ultrasound you can do with medical doctors. They'll run the ultrasound over the tendon, show that there's some inflammation and disorganization of the fibers. That's going to get you on a tennis elbow, a similar exercise that we're going to give you. The best recipe for fixing a tennis elbow is going to be rest. The worst thing to say, I know. There are things that we're going to do to speed it up for you, but any sort of inflammation, it's just about trying to bring that inflammation down. And the best way you can do that is rest. So a lot of our clients will say to us, like, I love playing tennis, I love doing DIY, I'm not going to stop doing that. So how can I get through without having to rest? So we always want to try the best we can to allow them to keep doing the activities they're doing and living their life. But maybe we have to modify them slightly as we go through that sort of 4 to 6 week window, just getting pressure off the elbow here. So how do we treat tennis elbow? This is really important. So there's 2 ways you can treat it. You can treat it on your own at home, or you can come and see a professional. One of our sports therapists here, physiotherapists, they are amazing at treating tennis elbow day in, day out. Where we are based in West Byfleet and Addleston in Surrey, there is, if you live in this area, you'll know there's probably about a golf course to every 10 people here. We have a lot of golfers, there's loads of clubs with golf courses and tennis courts, so a lot of tennis players coming in as well. Very active population around here, which is great, but obviously can cause problems with issues with the elbow. So we just want to make sure that we're trying to help them as much as we can to keep them active, keep them mobile, keep them pain-free for as long as possible. So let's start with the things you can do at home. So the first thing is a very simple stretch. So what you need to do is take your arm like this. This is the effective one here. And you're going to very gently just push back into the elbow here. You can see that there. All right, so that just helps to just mobilize the tendon. And then the big one that's going to cause the stretch is this one here. So you're bringing the hand all the way down. It's going to stretch all the fibers there. Now, stretching is really good for inflammation because it's going to take a lot of pressure off that area. That's really important we do that. I'll show you a different angle now, okay? Okay, so another way to do it is just have the arm like this. And this, you need to be very gentle with this. So I'm just pushing down on a chair here on the bed. And it's just about leveraging the wrist to take pressure off there. And you can sometimes just move the wrist a little bit like this, move the elbow to get all the different fibers there, holding for 30 seconds. Be careful with this one, okay? And you can do the other way. I mean, this is more golfer's elbow, but you can do the other way like that. And you can also spin the arm around. Again, that's more golfer's elbow. You're gonna get the flexor tendons, but it does help just mobilize the elbow. So there's no harm in doing that as well, especially if you're playing a lot of tennis and sport. And again, just move the fingers a little bit like this. And then the other way, you can do like this. Oh, that's a really good stretch down the front of the elbow there, that tennis elbow. Second way, this is really effective and something we do in the clinic, but you can also do it at home. So this is what we call a Graston blade, okay? It looks a bit barbaric, I promise it's not. You see these hooks here, these are beautiful to get in some of those tendon areas. So what you do is, I'm just gonna stand up for you here. You'd essentially just run it over tendon. We put a bit of massage oil on, and then we run it over there. We do cross friction on it to get the different fibers. We go different ways. We get the hook in there, can be a little bit tender. And then what we do is we start to get you to move like this. So you can move yourself whilst rubbing. It's kind of like one of those, pat your tummy and rub your head at the same time. It's quite hard. But you can get someone to help you with it as well, but it has to be relatively active. And you see how it's starting to make my arm go a little bit red? That's perfect. It's bringing some blood flow to the area, reducing that inflammation, okay? Now, I know what you're gonna say. I haven't got one of these at home. Yeah, me neither. So what you need to use is a metal piece of cutlery. So I often find like a spoon is really good with a nice sort of round edge like this. That's really good to use. Bit of massage lotion or some moisturizer on there. Do that for 30 seconds to a minute, let everything die down, and then try and do that a couple of times. So like a nice hook spoon. I don't know if you ever have Asian food, they have those like lovely little china dishes to eat the broths with. So the china sort of spoons, use those, the edge of those is pretty good. But otherwise, I think you can get these on Amazon for 10, 15 quid. But I would start off with a cutlery and then sort of go through there. You don't have to use it just for tennis elbow, you can use it on other muscles in the body. I know Mike and Ollie here, the physiotherapists, they use it on the back muscles, use it on your legs, just taking pressure off there as well. And the third way that I love as well is using a massage gun. So we have these here in the clinic, and again, you can get these on Amazon for as cheap as probably 30 quid. I don't think the 30 quid ones are as good, but I'm biased. This is one we have here, it's West Chiropractic branded massage gun. We sell them here for £90. So it's kind of the middle of the range, I think like a Golf, a Volkswagen Golf. You can get them for like 400 quid. The guys use one called a Hypervolt Theragun, but they're much more expensive, but they're more professional type ones. So we use them here in the clinic, but this is something we use here. So you can just pop it on top here, Try not to go on the bony bit, just go on the tendon. So you're literally just making sure the tendons are, do the movement through there. And I use this for about a minute, 2 minutes. It really helps to break down some of those adhesions in the muscles, loosens everything up. And again, you can move your wrist at the same time here. You want to do this pre-activity and post-activity, just to make sure you're getting pressure off those areas. Those are the things that I would recommend to start doing at home. Well, what can we do for you here? So in the clinic with tennis elbow, we try to look at the whole area around it. So we focus on the wrist, as well as the shoulder, the neck, trying to bring the thoracic spine back. If there's overcompensation through the shoulder, that can often put pressure around the elbow. We need to make sure we're trying to bring everything back in a good position, pressure off the nerves that supply the elbow as well, just to help that area heal as quickly as possible. The other thing we use is something called shock wave therapy. So that's a high intensity sound pressure that goes into the tendon. Amazing research behind shock wave therapy and helping with tennis elbow, lateral epicondylitis, which is really, really effective at using that. It can be a little bit tender, but it's very, very effective. So Ollie and Mike use that here every single day on our tennis elbow clients. Get great results. Other thing we use is acupuncture. The needles, very, very fine needles, not like needles in the doctor's surgery where they're trying to extract things from your body. These are microfiber needles. You don't necessarily feel them too much. They go in, create an inflammatory response, break down some of the adhesions in the tendon, and it allows it to heal much quicker as well. It's a lovely way to do it. Deep tissue massage, we also use that around the area here to break down some of the adhesions, just get everything in the best position, taking pressure off that tendon as well to allow it to heal faster. So hopefully you got some really good information from this video. If you know anybody that is suffering with tennis elbow and not able to play tennis, squash, do the things they love and staying active, please share the video with them. Please like it and obviously subscribe to the channel. Thank you so much.